Hi dear students, today we begin our lesson with chapter number 15, Drugs. In this chapter you will find out about the meaning of the term drug, antibiotics, misused drugs including heroin, alcohol, anabolic steroids and nicotine. Arm race, page 188. Carbapenem is an antibiotic. Antibiotics are substances produced by one living organism to kill off another living organism. So carbapenem is one of the antibiotic. It is a substance that used to kill bacteria that are causing bacterial infection in a person's body. Okay, used to means nowadays carbapenem is not as effective as it was. Okay, why they are not as effective as it was? Because bacteria get resistant to antibiotic as we use the antibiotic for over and over again. The reason that the name of this antibiotic is not well known is because it is the last resort antibiotic. It is only used when bacteria can't be killed by any other antibiotic. The more that a particular antibiotic is used, the more risk there is that some particular population of bacteria will develop resistance to it. It means that some mutation or some changes in the bodies of bacteria happens and they become resistant to a particular antibiotic. So this means that antibiotics that were once very effective at curing bacterial infection may no longer work. Okay, now we need to update our antibiotics with passage of time, just because as bacteria are getting stronger and stronger, we need to improve the quality of the antibiotic in order to cope with these infections. What is a drug? A drug can simply be defined as any substance taken into the body that modifies or affects chemical reactions in the body. Okay, or drugs are the chemical they change the way our body behaves. There are useful and harmful drugs. Medicinal drugs are useful drugs and they may be antibiotics or painkiller, and some of the drugs are harmful, and harmful drugs are narcotics, for example heroin, alcohol, tobacco smoking, etc. Medicinal drugs, antibiotics. Antibiotics are substances which kill bacteria but do not harm other living cells. Most of them are made by fungi. So antibiotics do cause danger or do affect or kill liver cells, but to a very smaller extent. Overuse of antibiotics can greatly affect cells inside the liver. Okay, so it means that antibiotics should only be used when it is necessary. Unused or unnecessarily we should avoid using antibiotics. It is thought that the fungi make antibiotics to kill bacteria living near them. Bacteria and fungi are both decomposers, so they might compete for food. So this is another definition of antibiotics. Antibiotics are substances produced by one living organism to kill off another living organism. So some of the substances are produced by fungi. Fungi is a living organism, and substances that are produced by fungi kill off bacteria. Bacteria is again a living organism. So substances that is produced by one living organism to kill off another living organism is said to be antibiotic. Okay, next, the first antibiotic to be discovered was penicillin. Penicillin is an antibiotic produced by fungi, penicillium. It is made by penicillium, a fungus which you might see growing on decaying fruits. Penicillin kill bacteria by stopping them making their cell walls. Viruses do not have a cell wall, so they are unharmed by antibiotics. Okay, for example, you cannot cure viral infection by antibiotics because viruses do not have any cell wall. Therefore, you cannot use antibiotic to kill off viruses or stop viral infection. Misuse of drugs. Opium puppies produce a substance called opium, which contain a number of different chemicals, for example, morphine and codeine. Okay, morphine and codeine are the useful substances for most of the medicine to be manufactured. But these two substances can also be used to produce a heroine, one of the dangerous narcotic or one of the misused drug. Opium is also the raw material from which heroine is produced, which is also used in medicines. Heroine can be addictive. It means that once a person used to use heroine, so it become addictive. Okay, not each and every person get addicted to heroine, but most of the people do. Heroine is powerful depressant. Depressant means it slows down the activity of the brain. Heroine is metabolized to morphine, okay, which fits into some of the endorphin receptors. Endorphin are actually the hormones produced inside the body specifically after the exercises. And endorphin is a feel-good exercises. It makes you feel good. Now, when heroine is metabolized inside the body, it produces morphine, and the morphine fit exactly onto the endorphin receptor. For example, during the synaptic cleft, endorphin move from one neuron to the next neuron. There are endorphin receptor on the postsynaptic neuron. So morphine exactly fit into the endorphin receptor. Therefore, it make you feel good. Okay, they are actually dangerous. They are not endorphin, but they actually give you the feeling of endorphin. Alcohol. Alcohol is a very common drug in many different countries. People often drink alcoholic drinks because they enjoy the effect that alcohol has on the brain. Alcohol can make people feel more relaxed and releases their inhibition, making it easier for them to enjoy themselves and to mix and interact with other people. Alcohol lengthens reaction time. Okay, lengthens reaction time means that, for example, let me define the term reaction time first. Reaction time, or the ability of a person to respond to a particular stimuli, is said to be the reaction time. Okay, so if you are slow, if it take longer period of time to react to a particular stimuli, it is actually something very dangerous, specifically when you are driving a car. Okay, alcohol can increase aggression in some people, and large intake of alcohol can kill. Okay, so these are some of the bad effects of alcohol. Okay, whether in smaller quantity or larger quantity, alcohol is dangerous or fatal to your body. Alcoholism. Alcoholism is actually the phenomenon you cannot live without the alcohol. Alcoholism is a disease in which a person cannot manage without alcohol. It means he must use alcohol in order to work and function properly. The cause of the disease is not fully understood. Although it is obvious that you cannot become an alcoholic if you never drink alcohol. Many people regularly drink large quantities of alcohol but do not become alcoholic. Okay, so alcoholism is actually the phenomenon that alcohol becomes necessary for the normal functioning of your body. That is said to be alcoholism. Okay, most of the people get alcoholic, but not each and every person get alcoholic. Okay, probably there are many factors which decide whether or not a person become alcoholic. For example, your genetic actually decide whether you would become alcoholic or not. They may include a person's gene, means genetics, their personality, and the amount of stress in their lives. Okay, alcohol is poisonous to cell. The liver is often damaged because it is the liver which has the job of breaking down drugs such as alcohol in the body. And one more thing, one form of liver disease resulting from alcohol damage is cirrhosis, COPD, chronic obstructive pulmonary disease. Okay, let me introduce chronic obstructive pulmonary disease, or COPD, is actually a respiratory tract infection. Long-term pulmonary diseases are said to be chronic obstructive pulmonary disease. Pulmonary is a term used for something related to your liver. Okay, so alcohol badly damages your liver. Okay, so cirrhosis is actually a form of the disease of the liver, which the liver is completely damaged by. When the liver is completely damaged by the alcohol, the condition is known as cirrhosis. Anabolic steroid. Inside the body there are two types of chemical reaction taking place. Number one, smaller molecule join together to form larger molecule. Number two, larger molecule again join together to form smaller ones. Okay, the one in which smaller molecule join together to form larger one is said to be anabolism. Okay, so steroids are actually the hormones. Okay, so some hormones belong to a class of chemical called steroids. Steroid hormone include reproductive hormone, testosterone, estrogen, and progesterone. All three are said to be the reproductive hormones. Testosterone is a reproductive hormone in the bodies of male. Estrogen and progesterone are the reproductive hormones in the bodies of female. Many steroid hormones stimulate metabolic reaction in the body cells. They build up large molecules from smaller ones. One type of reaction that is stimulated by anabolic steroid is the synthesis of protein from amino acid. Testosterone, for example, causes more protein to be made in muscles so that the muscles become large and strong. Okay, most of the people who want to build their muscle, they usually use anabolic steroids, or in the form of injections or in the form of food. Okay, for example, oral steroids are less dangerous than the injection. Okay, both actually increases the muscle growth. Okay, or they become increase the size of the muscle in shorter period of time. One thing more I would like to add over here, anabolic steroid keep you longer in the gym, means you will have to work hard for longer, but it also has some worst effect on the bodies. Athletes and others have taken anabolic steroid to increase their muscle size and strength. These hormones can help athletes to train harder and for a longer period of time. They also increase aggression, which could give someone an edge in the competition. It means that nowadays there are particular tests for the athletes. Athletes used to stop anabolic steroid just 2 or 3 months before the competition, but now the test now their effects can stay for longer inside the body, and they can be recognized whether or not an athlete has used anabolic steroids or not. The use of anabolic steroid in sport is banned. Apart from giving someone an unfair advantage, taking anabolic steroid carries a serious health risk. For example, these substances decrease the ability to immune system to destroy pathogen, and they can damage the liver. Okay, most of the people have killed themselves. I would like to use the word kill by overuse of the anabolic steroids. High doses of anabolic steroid can kill the person, okay, and badly damage the liver. Okay, now one thing more I would like to increase over here is high doses of anabolic steroid. It decreases the ability of immune system to destroy pathogens. Means that even a smaller danger or a smaller threat to the life can cause you or can kill you. Tobacco smoking. Tobacco smoke contains over 1,000 different types of chemicals that are damaging our health. Among these, 3 are of prime importance. Number 1, nicotine affects the brain. It is a stimulant. Stimulant means that it increases the function of the brain. Okay, which means it makes a person feel more alert. Nicotine is an addictive drug. That's why smokers often find it difficult to give up. Okay, addictive drugs are difficult to give up. Number 2, tar contain many different chemicals, some of which are carcinogen. That is, they can cause cancer. One more thing I would like to add over here is carbon monoxide. Carbon monoxide reduces the oxygen carrying capacity of the hemoglobin. It means that hemoglobin carry oxygen to all parts of the body. When carbon monoxide is available, so instead of oxygen, carbon dioxide bind to the hemoglobin, and the bondage is actually permanent. Okay, it means that this hemoglobin is permanently blocked by carbon monoxide. If you inhale any length of carbon monoxide into the body, it can kill you. Smoking and heart diseases. Smoking increases the risk of developing high blood pressure. Number 2, as the blood passes through the lungs, it absorbs many substances from cigarette smoke. Okay, for example, the carbon particle or other particulates. Some of these make the wall of the arteries get thicker and harder. The wall cannot stretch and recoil as easily as the blood surges through them. Okay, for example, if you put your finger upon the artery, you can feel a surge of the blood. Okay, now what happens when somebody smokes? It makes the artery thicker and harder. Okay, and what happens? The wall cannot stretch and recoil as easily as the blood surges through them. Smoking also make it more likely that a blood clot would form inside the blood vessel, including the coronary arteries that supply the wall of the heart with oxygenated blood. Coronary arteries are the arteries that provide the heart muscle, the cardiac muscle, with enough amount of oxygen and glucose. Now, if these arteries are blocked, what happens? Supply to the muscles of the heart blocked. Now, the heart cells affected, and most of the cells die, and the heart stop working. This is said to be angina, okay, or mild heart attack. Smoking and lungs cancer. Richard Dole was the first person who recognized that smoking causes lungs cancer. Dole published the result of his research in journal in 1950, but it was many years before everyone was prepared to accept the link between smoking and lungs cancer. Much research has now been done on the effect of smoking on health, and now we understand how smoking, both passive and active, can cause lungs and other cancer. Let me explain the two terms, passive smoker and active smoker. Active smoker is the one who smokes, and passive is the one sitting nearby. It means that whether or not you smoke, okay, but if you are near someone who smokes, your body can greatly be affected by the passive smoker. White blood cells remove carbon and other material trapped from smoking cigarette by secreting chemicals. Okay, that is something very dangerous. Unfortunately, these chemicals can do serious damage to the lungs themselves, resulting in COPD, chronic obstructive pulmonary disease. Okay, white blood cells are actually our immune system. Okay, they actually stop molecules or stop bacteria or other living organism invading our cells by secreting chemicals. Now, what happens? Unfortunately, these chemicals can also greatly affect the lungs, okay, resulting in COPD. Let me tell you one thing more. There is no cure to COPD, chronic obstructive pulmonary disease.